Today we're going to talk about the cardiovascular system. This presentation is divided in two parts. The first part has to do with identifying the different types of blood vessels and also characteristics of the components in the walls of the blood vessel. Part 2 has to do with characteristics of the heart, a little bit about blood flow regulation, and finally about disease states of the cardiovascular system. Thank you. The cardiovascular system, Part 2. Part 2 describes the structure of the heart, a little bit about the regulation of blood flow, lymphatic vessel characteristics, and diseases. Now here we see the arterial pressure. Arterial, it allows sufficient pressure. It functions by allowing sufficient pressure for blood to go through the capillaries. So here's arterial, here's the capillaries, here's the venule. A low enough pressure to prevent damage to the capillaries, but a constant intermittent flow of pressure. So it lets some in and stops, lets some in. Intermittent flow is what it does under a low pressure. There's also a thing called autoregulation. Autoregulation is when the smooth muscle that's in the wall of the arteriole and the precapillary sphincters respond to metabolic needs. If you have low oxygen tension, they relax. When they relax, the caliber is increased and there's an increase in blood flow. And this is independent of the nervous system, hence the word autoregulation. So the smooth muscle cells that are in the wall here are the arterioles and also in the walls of the sphincters. These are precapillary sphincters. They are responsible for responding to a low oxygen tension. It makes them relax. Whenever it does, the caliber is increased. You will see the nerve that would be interacting with these cells. In fact, here we see nervous tissue interacting with smooth muscle cells of the vascular. This is a muscular artery here. Now, during exercise, the increase in blood flow to skeletal muscle is primarily the result of meeting the metabolic needs, namely that low oxygen levels reduce the contraction of the smooth muscle and their restriction of the alveolar blood flow. So in other words, a low oxygen tension causes it to relax, and that increases the caliber and increases the blood flow. And that's due to nervous or hormonal regulations as well as the oxygen tension. Also, there'll be an increase in heart rate as well. So the arteriole, here you see the endothelial cell, there's a lumen, there's the tight junctions, and media, and the adventitia, intima, media, endothelial cells, muscle, connective tissue. Here we see the venule. These are endothelial cells. The venule itself doesn't have muscle in it, and also this is the source of edema. Here we see a parasite of the venule. You see red blood cells and the platelets in the place between these two endothelial cells, and remember that the venule is a source of edema to occur. Here we see the human testis. This is the capsule. These are the centrifugal, so all this is capsule. Squamous cells on the very outside, simple squamous, and then there's connective tissue, fibroblasts and all. And we see the arteries, and we see veins in through there. And we also see lymphatics. And this lymphatic, you can actually see that there is a valve in there. So a lymphatic arteries, there's a capillary. These are lytic cells that we see through there, but here we see capillaries. So in most organs, the testis is one of them, the network of blood capillaries is paralleled by a plexus of capillaries of the draining lymphatic system. So in addition to have arteries and veins and capillaries of the blood vascular system, you usually have draining capillaries and vessels of the lymphatic system. So here we can see arteriole with the capillaries. Fluid is coming out of the capillaries and then it goes back into reabsorbed in the venules, but what doesn't go back in there goes to the lymphatics. So the lymphatics ultimately go from a lymph node back through the thoracic duct or some other lymphatic duct going back to the bloodstream. Now, what causes lymphatic fluid to flow may be contraction of muscles, vascular transport, pulsing vessels, we don't know, but one thing is for unidirectional flow. It has valves that control that, but it's relatively fast, remarkably fast. If you inject something, here's a lymph node, and here's an afferent lymphatic going into the lymph node. You can see where dye is injected in there. So compression of muscles or vessels or hearting, beating of the heart can cause fluid to flow. There is no pump. There's only one-way valves and the compression of the tissue, as you see. Also, the vessels are held open because they want to collapse by an anchoring device. So you have a little anchoring device to the connective tissue to hold the vessel up, and so it can receive fluid. So drainage and function of lymph, the function is to collect excess interstitial fluid, the lymph, from the tissue and return it to the blood. That's what you want to do. And drain, it starts with the lymph capillaries, the lymph vessels, lymph node, then it filters through the lymph ducts. It goes through the lymph node filtering, and then it goes to the thoracic duct or maybe the tracheal duct or the right lymphatic duct, and they empty into the bloodstream. So here we see in the human, we see the thoracic duct. And the characteristic of a thoracic duct is it has some smooth muscle in there, but it has a lot of connective tissue. So this is different from the artery. It does have endothelial cells on its surface, but the layer here doesn't have very much smooth muscle in it. It has mostly connective tissue in there. So the lymph vessels transport. You have transport across these vessels. You have an anchoring device to hold it open, and there's junction between adjacent ones. Also, the lymph vessels are important in transporting hormones, antibodies, fat, natural fat that come from the GI tract, fat from the GI tract. Here's a central lacteal. So this is the intestinal villus here and here. You have a central lacteal. That's going to take the fat from whatever you digest to go through here, and it goes back through here, ultimately through the thoracic duct, back to the heart. And so by going to the lymphatic, the fat does not go through the liver before it goes to the rest of the body, and that's a problem when you have a fat-soluble toxin. It doesn't get detoxified before it already does some damage. Here we see the hemosplenic cord. We can see some veins, even some with valves in them. We can also lymphatic vessels. Lymphatic vessels, this was perfused fix, so the blood was washed out by the fixative, but the lymph fluid was not washed out, and that's why you can see these are lymph vessels over here, some more over there, and here we can even see the valves of the lymph vessels. You can see how the fluid is stored, trapped back up in there by the valve itself. The valve is functioning to unidirectional flow. Here we see the aorta, the intima media with elastic tissue, and then the advent tissue and the vasa vasorum. We can see it again. We can see the elastic fibers in through there with the stain, advent tissue, media, and the intima. When we get to the heart now, we have different names. The epicardium is the outside, and we can see there it has simple cells on the outside and connective tissue. And then it has the muscle layer is a myocardium, and then the endocardium on the inside. You can see fat cells in through there. You can see arteries and veins of the vasa vasorum in there as well. And in the endocardium, you can see that you have endothelial cells with some connective tissue below before you get to the muscle. So this is the endocardium, myocardium, and the epicardium, as we see. The epicardium on the outside, as we see here, here, and here, is simple squamous mesothelium. That's on the outside. Here we can see the little simple squamous cells in through there, supported by loose connective tissue. So there's loose connective tissue as we see in there. Also, there's blood vessels as we see here, and there's nerve in there, as well as fat cells as well. So you do have connective tissue, fat cells, nerves, and blood vessels in the epicardium. In the muscle cell itself, we can see the intercalated disc. That is where one cell attaches to another one. Usually on the lateral side, there has gap junctions where it can communicate from one to another. So the major striations here are the intercalated disc, where one cell joins to another. The cardiac cells could be branched, but you also see the periodicity here, which is the A and I bands associated with muscle, striated muscle. And here we can see the intercalated disc, the macular adherence, the zonal adherence that we see attached there, and then there's gap junction for communication between adjacent cells to occur. In the plasma reticulum, which houses the calcium for regulation of the contraction to occur. Here we see subendothelial connective tissue here and here, so this will be a lumen, that's a lumen there, and then we see the endothelial cells. Endothelial cells, as we see there, and then these lines here, these major lines here, is the intercalated disc. You likely will not be able to find Purkinje fibers in slide 14. In the heart, we can see junctions between adjacent cells. These are intercalated discs. Also, there's gap junctions between the two that can allow communication. You can see the intercalated disc and through there, and it's basically at the ends with the gap junctions on the sides. You can see right here, it's the gap junctions, but it's the end-to-end is the dark band that we're seeing. You can see that myocytes could be branched pretty well, and they have a nucleus is pretty much in the center of the cells, not on the periphery for sure. And here we can see the SA node and the AV node, and the AV node sends fibers down in through there. These are the bundles of His or the Purkinje fibers. Now the SA node, there are internodal connections that go between the SA node and the AV node, and this distance here is partly involved in the fact that the ventricles contract after the atria contract. Atria contract and then the ventricle contract, and the SA node is actually what's going down to the ventricles, and these are the Purkinje fibers. Purkinje fibers are modified smooth muscle cells that look kind of pale, as you can see, but they're large nuclei you can see within these. We can see this one on 23, you can find pretty easily. Purkinje fibers, you can see they have junctions. They don't have intercalated disc, but they do have junction between adjacent cells, and they have a lot of these nexus or gap junction between adjacent cells. But if you look at the cell, it is a modified, you can see the myofibrils, they're modified cardiac muscle cells are the cells of the Purkinje fibers. And here we see a papillary muscle in the heart, as well as a valve projection of the heart, as we see. Now, a vasorum is a vessel of vessels, and here we see the elastic artery with a vasorum. We see a muscular artery with a vasorum. Vasorum again here in this elastic artery, and indeed the coronary artery is a vasorum of the heart. So we see these cardiac muscle cells, and here's a capillary inside there, which is part of the vasorum. There's a little piece of nerve as well. These are the myofibrils as well as the mitochondria in the nucleus of these cells. Now there are barriers in blood system. There's a blood-brain barrier. It's a zonal occludence of the endothelial cells is one of those things, and also the support cells of the nerves. Also, there's a blood-thymus barrier, and that's the zonal occludence of the endothelial cell and sheath of reticulum endothelial cells that help protect the cortex of the thymus. And then you got the blood-tacit barrier, and those are the occluding junction between the Sertoli cells. You do not have a counterpart to this in the female reproductive system. For our clinical correlation, we'll talk about the coronary bypass surgery. There's a vein, different veins could be used, one that's in the leg. that can be used as bypass block surgery. If you look at this video, it's a very good video on the bypass surgery. They take the vein, hook it to the aorta, and then just beyond the blockage of the artery of the heart. So blood coming out of the aorta will go through the vein and then just beyond the blockage of the artery, providing nourishment for the heart. And this is proper orientation is very important for the vein. You have to have it so the valves are not engaged, otherwise it would prevent the flow. So here we see arteriosclerosis, which is the blockage of the lumen because the intima has swollen. So age-related disease changes, arteriosclerosis, is really the hardening of the arteries. That is, the elastic lamina is replaced by connective tissue, so no longer can it stretch. And so remember, we were talking before about how the elastic arteries expand to dampen the pressure, and then it recoils to maintain the pressure. If you don't have that elasticity, you won't be able to maintain that pressure, and in fact that will lead to elevated heart pressure because they're unable to dampen the pressure. Atherosclerosis is a patchy, irregular thickening of the intima, and that's what we just talked about with the surgery to replace heart attack and stroke. So atherosclerosis is a common disease. The tunica intima is either damaged or dysfunction, changes occurs, you get foam cells, free LDL, macrophages move in, and they cause a fibrofatty plaque. And we can see they can go in there with angioplasty, expand that, maybe with a laser, and cut that out, and then pick up the different debris. And here we can see this is a heart, this is a coronary artery here now that's about 90% blocked, as we can see, and of course blockage of that causes ischemia, and the macrophages release their contents, and that's the cardiac infarction is what results. Here we see a pre-stent, about 90% block, composed to after the stent, where you actually gone in there and expanded the blood vessel and put in a stent that goes. Actually, that is my heart. In 2001, I had a stent put in my heart. That concludes the presentations. Thank you.